Peptides are protein which are chains of amino acids. Arbitrarily, if it's less than 40 or 50, the majority of peptides that we utilize are shorter than that, but they're generally attached to the cell surface, which then have secondary messenger and have pleiotropic effects. They have multiple effects. They kind of have like a supplement effect rather than a med, tend to have a very narrow, which actually you think would be safer, but it actually makes it more dangerous and risk for side effects. But like supplements, kind of like food, they have multiple effects. They're more specific, but also much more potent.
Hello, welcome back to the Dr. Joy Kong podcast. So today I have the one and only Dr. Kent Holtorf. So Dr. Kent, I am so happy you're here. I can tell you, I've known you for years and you are quite an impressive individual. So thank you for being here.
Thank you for making the exception to brilliance for this time. I appreciate it. Yeah, we go way back. It's interesting. Yeah, I love it. Thank you for having me.
Yeah, absolutely. I mean, we met about 7 years ago, and the time that you were just, talking about all these peptides, and very few people were talking about peptides. And it was so impressive. It's like, wow, this whole world. So you've delved into different cutting edge stuff long before a lot of people. And you've been well regarded as a pioneer and educator and leader in quite a wide array of areas of medicine. So I want to give the audience kind of a brief understanding of just how accomplished you are. So you are an innovator and also a leader and educator and entrepreneur. So apparently you've led 23 different centers and 12 franchises, and you're the owner and founder of Integrated Peptides. But you have done so much in advancing different areas of medicine, and you have also gone through your own health journey, which probably helped you to be as driven as you are in seeking innovative therapies to really help people to suffer less. So, so happy to have you on the show.
But yeah, it's all really for selfish reasons because I could not function. I was, so sick. I couldn't practice medicine. Talking to a patient was just so exhausting. I had Lyme, Babesia, Bartonella. Was very evidence-based. I'm still very evidence-based, but go to the university doctors that you look up to and they go, oh, you must be depressed. I'm like, no. And they couldn't help me. But, in medical school, like a lot of places, it was drilled into us that anything alternative, integrative, basically was quackery, was no evidence. And so I believed that. So I wasn't going to go to these alternative conferences. But then I went into heart failure. And my heart, because actually with the Babesia and the Bartonella, I had a high human chorionic growth factor beta, which caused fibrosis of my heart. So my heart would not fill, and it was just fibrosed, and it was terrible. I couldn't stand up straight. I couldn't walk upstairs, just sweating, like going 1 mile an hour, to nowhere. And so I'm not going to live like this.
Was it in medical school that you had this, or was it after you became a full-fledged? I know you were an anesthesiologist.
Well, that's why I went into anesthesia, because talking to a patient was so exhausting. I said, okay, maybe I can do anesthesia. They're asleep. You don't speak to them. But I forgot how you have to get up really early. But the fact where I'm just like, I could not function. Like, having Lyme is the worst thing ever. But heart failure on top of it is just horrible. So I was going to off myself on Halloween, and I said, well, I'll go around the world and look for treatments that, to help to cure myself. But if I don't, a good life. And so kind of went around the world, some great treatments. Like I went down to Puerto Vallarta and in the Lyme, Lyme, Mexico, and Omar Morales, awesome. I brought down Lyme antigens, and we basically cultured my white cells and stimulated them to the Lyme antigen. So we had this, the whole thing going. It worked really well. We tried to freeze it and use it multiple times. We screwed that up, but it was good. So a lot of treatments that worked, but they didn't last. And then I went through Europe and Belgium, and I did some peptides. I didn't really think anything of it. And I'm like, okay, I'll just do it. And then about 3 or 4 days later, I walked up the stairs. I'm like, wait a minute, what the heck is going on? No, it couldn't be a peptide. No, it couldn't be. And I went back and did them again. I'm like, oh my God, I feel even better. So, and kind of extended my stay from just like, doing all the peptides. I'm like, oh my God, this is amazing. Took about a year to get them into the US. And that's how I met Ryan at Tailor Made and said, hey, let me speak for you, get the peptides. And so kind of helped them. I mean, I'm not going to take any credit, but they're amazing. And just kind of set the journey. And it's really helped. I kind of in the back of my mind felt that, hey, this illness will be a good thing at some point. But when you're in it with Lyme disease and Babesia, Bartonella, it is horrible. And then heart failure on top of it. And, so the cardiologist said maybe in 10 years, you can get 10% better with just extensive cardiac rehab, right? And then so after about less than a year, I went back into his office standing up. He goes, oh, that's interesting. You get on the table, and they do an echo. He goes, it's pretty normal. And he goes, okay, see you in a year. He didn't ask me what I did. Didn't do anything.
He was not curious why you were doing so well.
You see it with these standard docs.
Wow.
But it's just like, and and I found when I'm sure you see this too. And if patients, multi-system illness, and they've seen 20 doctors, and they go, and you send them back to their doctor better. You think the doctor's going to be happy? No, they're not. It's a strange thing, but standard medicine, they're in a very bad system that they can't give good care. It's like impossible. And it's getting worse. So we'll see if anything changes here in the near future.
Yeah, it's fascinating because both of you and I were educated in that system. And we were really not equipped in getting people, to heal on the fundamental level. We know how to keep them hanging. There are very few chronic conditions that we actually have the tools to get them well. Acute issues, I think we're able to make some good.
Yeah, it's like if your eyes there, you get a broken leg, it's a good place. If you have anything out of the box, multi-system, forget it. It's just, if the doctor doesn't know what it is or how to treat it simply, it doesn't exist. It's the patient's fault. And we're getting sicker and sicker. We're the sickest country in the world, and we spend the most.
Yeah. So you now you're the rebel. But you're leading the rebel camp, which I believe is the mainstream some 10, 15 years down the road. That's just going to be...
Oh, I have to send you one of our proud t-shirts.
Yeah. So how did you turn your life around? Because obviously you're vibrant, you're lecturing everywhere, and then you have your own center, beautiful place in El Segundo. How did you turn your life around? What did you do?
Originally, so when I was just feeling horrible, again, no exposure to anything integrative, alternative, precision, functional, whatever. And I kind of snuck off, and I'm like, because I'm told it's not evidence-based, so I'm listening to these lectures, and I'm like, this is more evidence-based than what they're teaching me. I mean, this is crazy. And so I really kind of latched on to thyroid and really got into it. I think it was Rousier at that time. And then so I quit anesthesia and just took over, went to family practice, took over a family practice and opened up the Thyroid Optimization Center. And it was an insurance practice and converted to cash with less than a year because we didn't market. People waiting in line outside the doors because we're just getting so many people better with T3 and, not going by the TSH. And I'm telling you, if any, physicians out there or patients that are sick, like almost always the thyroid is low and treating away with T3 is just miraculous. You combine, if you learn thyroid and peptides, you will have, throw a little stem cells in there, maybe a little ozone. You will have patients from everywhere. You'll be getting patients better. I've seen the most amazing doctors and, 15 doctors because they're missing those things. And, like and we started the nonprofit National Academy of Hypothyroidism just to really show that the way we're practicing, diagnosing, and treating thyroid in this country is wrong. It's not evidence-based. And so like 80% of people go undiagnosed and all they need is a little T3 and it's just, it's amazing. I can go on and on with studies on that. So a lot of lectures on that. So I won't, I can tend to just go off on that, but I want to cover some other stuff today.
Well, some people say that thyroid is possibly overtreated. That for anti-aging arena, like everybody has, not no perfect. Very few people have perfect T3s, right? So if you try to optimize T3 and then that suppresses TSH to a great degree, is that too much?
Yeah, no, TSH is the most worthless diagnostic parameter. And you can overdose. The people that get too much are on T4, and it's making all this reverse T3. And for instance, we can talk about the thyroid bioregulator, which is very interesting, or thyroid axis bioregulator. And because what happens when people are chronically ill with inflammation, stress, age, inflammation, autoimmunity, whatever it may be, they get pineal hypothalamic pituitary thyroid dysfunction. So they have a central hypothyroidism, right? And so we always think that, well, it's really easy that when the thyroid levels drop, the pituitary responds, increases TSH. No, it does not. It's damaged too, even more than the thyroid. So they have, this is the pattern of a low thyroid, chronically ill, chronically inflamed person. Is a low normal TSH, a high normal T4, and I'll tell you why, and then a low normal free T3 and a high normal reverse T3. But if most doctors will look at that, they go, oh, you got low normal TSH and a high normal T4. Oh, you're a little hyperthyroid. It's the opposite. And because the thyroid doesn't get, especially T4, does not get into the cell because of its active transport. All the endocrinologists think it just diffuses in. T3 is less energy dependent than T4. And also the deiodinases would convert T4 to T3 in the body with any inflammation, age, stress. It goes down. The deiodinase type 1 is downregulated, so you get less T4, T3. In the pituitary, it goes up. It's stimulated, so you get more conversion. So TSH goes down as the rest of the body's starving for thyroid. And actually, look at depressed patients. For instance, the largest study ever done on antidepressants, the STAR report, showed that giving T3 was a better antidepressant than every other antidepressant, less side effects. It worked when the other ones didn't. Another study like bipolar patients, 135 treatment-resistant bipolar patients. They tried on average 14 different medications, no response. They gave them all T3 regardless of their thyroid levels. 80% responded and 30% total resolution of symptoms.
Okay. So you will feel pretty comfortable just looking at people's free T3 level then, as far as target?
No, what we'll do is we'll check everyone's basal metabolic rate, which is the gold standard. Also, the British Medical Journal showed that a knowledgeable doctor looking at someone's ankle reflex was a better test than blood tests. They correlated with symptoms better. They diagnosed people that actually benefited from the treatment. So how could that be? So a normal reflex goes, but the lower the tissue level of thyroid, the slower the laxation phase. So we have a computer that measures that. Combine that with the basal metabolic rate, you have your diagnosis. And if people diet more than 3 sessions, they'll drop their metabolism, their thyroid levels drop, and it doesn't go back to normal even when you go back to normal eating. So people say, I'll correct my metabolism. They have, but their thyroid function tests look normal. So many people need T3, and it's shown to reduce cardiovascular disease and risk factors. And it's one of those other conspiracies that it's just nuts that people aren't doing it.
What's the level that you would target your patients at for a free T3?
Well, I mean, that's just kind of like one parameter. So you got it. Like we do all the tests, and symptoms matter a lot too. Check their body temperature, and so there's no set number. And you can look at also the free T3, reverse T ratio, the T4, T3. People love all the mathematics stuff, and we have actually a test if you go on National Academy of Hypothyroidism, an algorithm that goes through it. But there is evidence that you need it, but it's also common sense and the art of medicine where people we've had some doctors that they're just like, well, you said that the TSH, it doesn't matter. Just keep giving more. No. What are you talking about? The person, they're racing hard. They just keep giving them more. Stop it. So it's like being a doctor. It's well, how do I know what to do? You're a doctor. So, or even you get family practice docs, the TSH is 8 and I don't know what to do. Oh my God. but I don't know, it's scary. I don't mean to, but we're just like kicking out of our own way,
Yeah, yeah. Well, I know thyroid is a big subject, but definitely I want to move on to what you're really passionate about, peptides. But before we get there, I want to ask you just one question about iodine, because there's some controversy out there. Some people think it's really crucial that you replenish it, but someone like Dr. Christensen,
Dr. Rumstein, yeah, I love that man, yeah.
and he said that the modern thyroid, the like a pandemic almost, everywhere in the world is because of oversupplementation of iodine. What's your opinion on this?
Oh, he says oversupplementation. Okay, that's okay. I'm in the middle. Well, I'm usually never in the middle, but I'm kind of like the moderate in this one because they both are. Neither of them are lying. They're both telling the truth that you can give iodine, especially in a Hashimoto's patient. And we'll check everyone's urine iodine the first visit, but we don't treat it, even if it's super low, because if they have Hashimoto's that you give it, they can just totally flare. But if you go very, very slow, the iodine will actually reverse the Hashimoto's, or to some degree. We do a lot of other things, and we'll talk about the thyroid bioregulators. So it does work, but it matters the time frame. So if you're just slamming people with thyroid, or patients will go out and get all the seaweed. You go, I'm helping my thyroid, and they flare. See, I told you. But so they both can point at each other and say, see. So they're both right. It's just, you gotta, just basically, okay, well, in this situation, and just when you go slow, it kind of solves the whole problem. So really, they're both correct.
Okay, great.
That's the first time we'll ever be politically correct. I'll never do it again.
Offending no one. Okay, so let's come and talk about peptides. So you have, you're dealing with a lot of chronic illnesses. So you must have found peptide like a kind of quite a gift.
A game changer. And every doctor that we train on it, it makes everything, getting the sickest patient, even healthy patients, from A to B. Let's say like Lyme patients, instead of doing 2 years of antibiotics, you don't need antibiotics, or you do 3 months. And we can't really see practicing medicine without it. But of course, the powers to be would love for you to be without it. But it's a game changer. I mean, changed my life, changed our practice, changed so many doctors' practice.
So of course, now is gaining so much popularity. I remember first time I met you, you were talking a lot about thymus, like all these thymus peptides. So which are your favorites?
Interesting. Yeah, I mean, if you look at the studies on bioregulators, and they probably asked people, and I'm sure they probably said thymus and the pineal and the vessel probably are the three, and those have the most basic literature on it. But we've also discovered some new ones, including the thyroid axis bioregulators, the stem cell bioregulators, a number of them, and mitochondria bioregulators, what isn't out yet, but we're excited about that. So we'll see. But even like, for instance, the kidney bioregulator is that, I have leftover chronic kidney disease from chronic Lyme, babesia, and that. So I'll have, it's probably TMI, but like foamy urine, because I'm dumping protein, right? If I take a kidney bioregulator, about 6 to 12 hours later, no more foam, that lasts for 2 to 5 days. We have people on dialysis that are off dialysis from it. One of our employees, her mom was on dialysis. I told her, hey, give her this, and I just forgot about it. And then she gave it to her mom, and she kind of forgot about it. And all of a sudden, the doctor, she goes, oh my God, the doctor's freaking out. I don't need dialysis, and it's reversing all these people. And then that's just that organ. We have it for brain and liver, so reversing liver cirrhosis. It's just amazing stuff.
So for people who are not familiar with bioregulators, how would you define that?
Yeah. So, peptides are like the protein, which are chains of amino acids. Arbitrarily, if it's less than 40 or 50, depending on what group you talk to, it's a peptide. But you look at the majority of peptides that we utilize are shorter than that, but they're generally attached to the cell surface, which then have secondary messengers and have pleiotropic effects. They have multiple effects. They kind of have like a supplement effect rather than a med, tend to have a very narrow, which actually you think would be safer, but it actually makes it more dangerous and risk for side effects. But like supplements, kind of like food, they have multiple effects. The peptides are just, they're more specific, but also much more potent. Now, bioregulators are a peptide, but a subset. They're, by definition, need to be 2 to 4 amino acids long because they are totally bioavailable as long as they're capped. So the body, because the big thing is the peptides haven't caught on for a big reason. Everyone goes, oh, that's going to break down in the gut, right? But if the body needs a peptide or even a protein, it will cap it. It will acetylate it and amidate the ends. Now, the enzymes do not attach to it and break it down. It also makes it much more bioavailable. And so if you cap those, which were all the peptides we use are all capped, and then there's like stable BPC, which is, they had the patent on acetylated capped BPC. It ran out. So they came out with a BPC salt and called it stable BPC, which is brilliant, but it really should be unstable BPC, the arginine BPC. It's nuts. And so they'll go, and they work differently. They're very bioavailable, go through the gut, and in the blood, serum, and then go into the cell and into the cell nucleus. And they'll attach to activators, inhibitors, and they'll modulate the basically transcription. So they work epigenetically, and they turn genes on, turn genes off. And the nice thing is they very much tend to turn on the healthy genes, the anti-inflammatory genes, the younger genes, and turn off the aging genes, and that. And so very protective, exceedingly safe. Most of them take 1,000, 100, 1,000, 10,000 times a dose, and it's nothing. Try that with water, you're dead. They also work at nano and picograms, which were, a basically 0.0 with 9 ones and a 1, less than a milligram, and they're effective. So you talk about a therapeutic range is crazy. So, and people are always like, oh my God, how do I do this? There's so many. I mean, you can't screw up, really. I mean, I'll say that with a couple caveats, but it's so rare to have a significant side effect. With that said, Lyme patients, Sears patients, like even a supplement like glutathione or something, I would tell them, look at it for a week, smell it for a week, lick it, and then take, 1/100th of it, and they still react. So they can react to some of the generally peptides. And like peptides, I think people react mostly to are probably discretadox or growth hormone. But even though they'll react to like KTD.
What kind of reactions?
Oh, like, just don't tolerate it, a kind of a Herxheimer reaction.
I see.
Yeah. And like KPV, which is anti-inflammatory, but it boosts the immune system, antimicrobial. I mean, they'll even react to that, which is pretty amazing. BPC 157, probably the most, common one that people use. But some people do get a little anxiety with it, and it can be activating. So, you go slow, but in general, normal people, we are not, occasionally people can react. But people, when a patient says, I'm sensitive, you need to listen to that, It's like, oh, yeah, no problem, here you go. And then they have a huge reaction.
So when you give people, let's say, heart bioregulator or kidney bioregulator, I assume you're giving a group of peptides, right? Group of bioregulators. How many in the kidney bioregulator product? How many different kinds of bioregulators are there?
Yeah, so no one knows that officially what the kidney bioregulator, the active ingredient is. I'm sure Cabazin knew, or they know, but they're not telling anyone. But we have found 4 kidney bioregulators that work. So, and it is also, so there's extracts that, so let me give you a little history of the bioregulators. Maybe this is a part about, I'll try to be quick, but it's very interesting. So, when it was during the Soviet Union, they found that their high-speed test pilots or submariners and their, who else was it? Oh, yeah, cosmonauts were aging super fast, right? And they're like, well, we got to do something here. And so they went to the KGB hospital, and it worked there was Pavlov, as in Pavlov's dog, right? And he was actually into peptides and things, and also Cabazin. So they worked again. They said, you shout fix this, right? And okay, we will. Either they got super lucky or super smart, or they were doing, some studies of this area, but they found that taking the thymus, basically is in the breastbone, which modulates the immune system. And that's what happens as you get older. You have Th1 here, you get stuff inside the cell. This is very oversimplification, but Th2 gets stuff outside the cell. As you get older, as you get sick, as you get inflamed, you get stressed, it goes like this. So you can't fight intercellular infections with a Th1, but you have all this Th2 inflammation. And that causes then this vicious cycle of ideal hyperlipidemia dysfunction, immunoactivation coagulation, mitochondrial dysfunction. Now you can't, just so goes around and around. So do you snap that back? And that's the thymus. That's what giving thymus. Basically, now you just anti-age the whole system. Even the CDC says that aged individuals have at least one chronic illness due to involution of the thymus. And they're trying to do these things like, revive the thymus and all this stuff. Just give thymic peptide. It's cheap, it's easy, it's safe. And you basically anti-age them and fix their immune system. Now they can fight cancers. It will eliminate, and this immune modulation that happens, the abnormal, is the cause of these diseases of aging. And we can just stop all that stuff. And it's just amazing that they don't do it. So they found that it was very effective. But it was a Soviet secret, right? They gave it to the military and the Olympic team. The Olympic team did pretty well at that time. And then with all the Soviet Union, they started publishing, but it was in Russian. It was going to pay attention, right? But thousands of studies on this stuff, thousands and thousands. And I'm trying to learn a little Russian. I'm horrible. I should learn Spanish first. And then people started noticing, hey, well, what's going on here? So then it started getting more and more. And then Cavison took the lead and kind of, brought it to the U.S. And it's just, I thank God I would not be here. I'd be dead without these things. So
were they taking different organs and getting extracts and analyze?
So they focused on the extracts, and so, but it's expensive. You got basically one at a time. So it's they have 21 or 24, depending, but you got to take 24 pills. But if you can isolate the active, now instead of taking 20 milligrams, you take 100 micrograms. Okay. So, basically 2,000 fold less. So with that and very, very little side effects, and, people get so tired of taking so many pills. But so we're combining them, for instance, with the Cognipep. We have, 4 or 5, different parts for the brain. Pineal pap, the same thing. So we're putting anywhere from 4 to 9 of these things together, and we're able to do it at a much more economical price because we're not having to pull the extracts out of all these things.
Okay. Yeah. So the bioregulator products that people are using these days are actually synthetic.
Using the natural. And the problem was they're all in Russian, right? And you say, what the heck is that? You try to, someone tells you what it is, you got to check all the time. And then Nature's Marvel, which I love the company, basically put it in English. So, there's heart, there's vessel, there's brain, there's ovary, there's liver, there's muscle. So these people know, but you got all these pills that you're just taking, and they try to make it so you rotate so you're not overwhelmed. But, I don't know if it's really a meta, it's really a financial thing. So really it is so much better. The effect is so much better and cheaper and cost effective. Combining, all these ones and okay, you got a brain issue. Oh, here's the 5 or 6 that need to be given for the brain. For fertility, here's the fertility, formula, or anti-aging formula, which includes a bunch of stuff, and stem cell bioregulators,
Okay. So I assume initially when you started doing peptides, you were doing subcutaneous injections?
We're actually doing IB. We started with IB. Yeah, we're getting them out of Germany, and we call them cellular peptide. People just loved them. Yeah, and then also we couldn't get them, but they were great. And I was speaking at a conference in Thailand. I ran into them again. I'm like, we need your stuff. And they're like, we're scared. I'm scared. Let's do. So, but interesting. Yeah.
Yeah. Why were they scared?
Oh, just dealing with the U.S. that the U.S. will come down. I'm like, the worst thing you do is heal patients, and like with importation, they won't let it in. They'll lose the company or stuff.
I see. Yeah, and then somehow you transitioned to producing a lot of peptides or supplying peptides in the PO format, so taken by mouth. How did you make that switch?
Well, yeah, I mean, always interested in how to do it. I mean, I got tired of doing 50 shots a day, and you do get fatigued. And so essentially hired a army of FDA attorneys, who was pretty much the answer. And it is harder to find a good attorney than it is a good doctor. It's hard to find a good doctor. So, yeah, it's funny. It's like people, specialists don't know medicine. Attorneys don't know law. And so it's just interesting.
I've seen that. Yeah. So you felt that a lot of these peptides could be given by mouth.
No, I know they can be given by mouth. But there's people giving stuff by mouth and sublingual with no basis. If something is 4 amino acids or less, it has a okay chance. But there's a lot of variables, and there's a lot of algorithms you can do there. You can test them, and we just purchased a very sophisticated lab at the university at Ensenada, where we're going to be able to do all these tests like this directly, instead of like trying to guess with a good degree of likelihood. But I'm telling you, no one even it's rare that other question is disparity, but test even the purity, but let alone bioavailability. But they're putting like sublingual a 34 amino acid peptide. There's no way it's going to absorb. And they'll say liposomal. They take some lecithin and shake it up and go, oh, here's liposomal. Anything will absorb. That's ridiculous. It's clapper. If we could do it, I'd do it. But it's not. It doesn't work. And we test the heck out of everything. And again, we just invested significant amount of money that we're going to be able to do some more sophisticated tests in the Western Hemisphere on bioavailability, and we're doing clinical trials and things like that. So we got a number of places that we're doing satellite clinical trials as well. We've been doing a lot of things with veterans, and found some unique things about veterans that I had no idea about, that why they're all sick, and it's incredible stuff.
Yeah. So are you only focusing on particular kinds of peptides, so using those in a PO format, or do you?
No. Yeah, I think you got the confused, but no, we use everything, and it's not just peptides too. I mean, we use meds, and we're like big guns if we need IVs. I mean, everything is a tool in the toolbox, and these have to be very good. Now, I'm not an ideal hug like, oh, it's got to be oral, like No, injectable for a lot of things. Some people like injectable. Let's say with like BPC, they think injectable works better. Other people, they think PO works better. If you look at the studies head to head, all the studies like head to head with BPC is unique because it's 14 amino acids. It theoretically should not absorb, but it absorbs very well when it's capped. And the studies show that for systemic effect, giving a capped oral versus a synthetic dose, whether it's intraperitoneal, IV, sub-Q, it's equal potent.
Okay.
But yeah, I'm not, I use what works. I'm a clinician. I'm not, trying to push one way or the other. We'll do whatever works.
Well, there are people who have objections about the oral forms because they're not sure how well they could be absorbed, because the classical way is putting directly in the body through.
And that's fair. That, we can say it about a lot of the, we better inject it to make sure. But how do we know? We do have some tests, not a ton, but it's the effect that, how many people get better with oral. It's definitely, placebo always has its effect, but it's way, 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 way above that. Especially the people that are sick, the chronically ill patient, multi-system, they don't respond to placebo. It's a nocebo. They actually have a negative response to it. So, they've been sick forever. They've taken hundreds or thousands of meds and they take this and they get better. Oh, placebo? Unlikely.
So which of the peptides are actually good to be used in an oral form? What about Promerlin CJC? What about MOTS-c? No?
Maybe. We're trying to do some studies, but likely no without alteration. So they have to be altered, which is an analog to have them. That's what they do in big pharma. So they alter them. So now that they can absorb, but now it's not a supplement, it's a med. So, and anything that's injected, nasal, sublingual, is by definition a medication. So most things that are meds are meds. And there's happens to be a little lane for the supplements. The bioregulators, different story. Essentially, all of them. But there's also ones that are short that do break down, like GHK. GHK is not great orally; it breaks down. But if you cap the other ones, they're good, and at least 80% and above.
I see. Yeah. So you use a whole range of different methods, IV or sub-Q or oral, depends on the peptide, basically.
Yeah.
What do you think of MOTS-c? I mean, there's I'm still, because there's a little bit of controversy whether or not you can reconstitute MOTS-c and then use them for a few sessions, or do you have to use all of it all at once?
I wouldn't leave it out. It's in my stem cells. People like, it's running over a couple hours, and they're just dying there in the bag, right? But yeah, with MOTS-c, it's not very stable. And look and say, there's pretty high variability, but it's known to not be stable. And this is the case for a number of them. But probably after, I would say the half-life, this is somewhat of an educated guess, but it's maybe 4 hours, so basically, so in like 6 hours, it'll be, 30% less, something like that.
Mm-hmm. Yeah. And I want to ask you about cerebral lysin because it has gained, I think a lot of people are saying this is kind of like the holy grail, right, of brain regeneration. And the most common form is pig brain extract. That's the most common one that people get, correct, on the market?
It's been around for a long, long time. It's approved in 40 plus countries. Very, very safe. The essentially a non-existent risk for prions, and pigs they really don't get prions. Like mad cow, there's no mad pig. There's a little irritated pig, but not mad. And so they're very, very safe. But I didn't realize a lot of people were ordering compounded cerebral lysin. And so that you're relying on someone who hasn't been doing it for 40 years and supplying to hospitals and everyone to put pig brain. And we actually did natural BPC. We had someone make that. It was so expensive because they had to scrape it out of the gut, and the manufacturer, they will never do it again for us. It was just, it's hideous. And think about opening up all these brains and how you have to be, in terms of infection prevention, that you better, I would not take a compounded one. But I do a lot of cerebral lysin. And so it's tried and true. But like with the cortexin, the brain bioregulator, now, cerebral lysin it's a bioregulator. It's not. It has a bunch of different peptides. So there's long and short. And they won't even tell you what's in it. It's why if you look at the ingredients, it just tells you the amount of amino acids. And you look at the ratios just to make sure it's that product. But it really tells you nothing about what each, chain is and what the identity is. But we know, again, it works. But the nice thing is it does work orally as well. In the studies where they had just one dose, EEGs, and, change in that. So we've had very good results with it. And for even my the stepson, his brothers were saying, "Oh, he's got something wrong with him. He's just so irritated. He's just a jackass, right?" And I hear, I said, give him this. And we gave him the cerebral pep, and they're like, oh my God, he's back to normal, And we see that stuff over and over and over. So the kind of newer version is the Cognipept, which has the active, right? So it's about 2,000 times as potent. Then we add the subcortical brain, which is the pinealion. So it's kind of confusing because pinealion is amazing and people think it's pineal, right? It has some like pineal effect, but it's subcortical brain. They really screwed up naming it that. But the epicalon is the pineal gland one. And then the vessel, whatever you add to it works much better. And it kind of makes sense. It lowers the inflammation of the vessel. So you get a lot better transport. You get increased nitric oxide. So it dilates and you get much better delivery. And it kind of is that, basically the boost for everything. You can add, let's give you a vascular peptide, to everything. And it works and studies show significant difference with brain and liver or like anything. Or it's interesting with like the low T therapy, and there's like 4 to 6 different ones you can use. You have the testes, you have the prostate, bladder, liver, adrenal, and they found it's kind of confusing because you do them and people get increased libido, and they will get increased testosterone. But it's like if you leave 1 or 2 out, they don't get the increased libido, but it didn't matter which one. It's kind of strange sometimes that way. But it's really fascinating that these little small things are so non-toxic can make such a big difference.
Yeah. And I want to ask you, so the cerebral lysine that you're using, instead of being compounded, which is how these people were just processing the extract from the pig brain, right?
I wouldn't trust anyone with pig brain.
So how the product you use, how were they obtained?
It's a secret. No, I'm kidding. Yeah, so I would want to use the manufacturer with anything that's a extract that is injected. I would not use compounded. I mean, they're learning. I'm sure they're trying to be, but it's high risk because you have this pig brain. It stinks like hell. It's horrible, but so these are totally sealed. It's a ampule, not a. I wouldn't stick a needle in anything with brain in it and use it again. I just wouldn't. Same thing with kudoprussin, liver extract, injectable. Very good treatment. It's really hard to get now. It used to be all over. Working for so many illnesses and chronic fatigue syndrome, liver dysfunction, brain. But it's not something you want to leave out.
Yeah, but how is the cerebral lysine you're holding? How were they processed? Was it still originally from the pig's brain, right? Wasn't that how they? It's
I'm not a big fan of Big Pharma, but they are a major pharmaceutical company and they've been doing it. They have it down. And 40 years, their infection risk is non-existent.
I see.
Where I don't know what these other guys are doing. You never get a full story. Like, they buy it from this person, that person. Are they making their own? Do they even know how it's being made? So it's with extracts like that, I don't think it's worth the risk. Plus, you get it cheaper from the manufacturer.
I see. Okay. So there are 2 areas that I want to ask you about. One is, of course, I'm very interested in the brain. So that's one reason we're talking about cerebral lysine, but there's also CBAS, C-Link. There's the P2228 for depression. And there's dihexa. How do you pick what to recommend to your patients?
Yeah, no, that's a very good question. And the brain ones, I'm fascinated with them as well. And, like humanin is one, and it's a mitochondrial peptide, but they named it humanin because it made Alzheimer's patients human again. And now there's newer versions that are much more effective. And you're just like, holy crap, look at the data. And why aren't these getting out of phase 3 trials? They're just stuck there because someone's freaking paying them not to complete the trials. It's scary. And we're getting these meds approved for Alzheimer's that are just ridiculous. And 60% of people on the approval board have stock in the damn thing, and it's worthless.
Yeah.
And we have all these meds just sitting there, but you can get them compounded for patients. And again, there's like human, which been around forever. And much more potent versions. And there's so many great, brain things. But yeah, and like, Dihexa, 5-MeO-1Q, C-Max, C-Link, they'll work. And just thinking like at parties, like, used to whatever college stuff, and now we're older, we're like doing snorts of C-Max, so. But yeah, it even helped people with normal memory better. So, and like C-Lang, I found that I was stressed. I'm like, where's my C-Lang? It's much more calming. It's more immune modulatory, more antimicrobial.
Right. Anti-anxiety. Well, let's say someone has
like dealt with speech. I use injectables as well.
Yeah. So supposedly does C-Lank work better intranasally?
It's interesting that versus injectable, nasal is often more effective, especially for brain, because it goes basically, into the veins in there, right to the brain, and like for plate goes up kind of like you look at dementia. A lot of evidence showing that Epstein-Barr and these things that climb up herpes viruses, climb up the nerve and go into the brain, and contributing to Alzheimer's.
Yeah. Let's say somebody comes in with Parkinson's or ALS,
which is exploding from all the toxins. It is the fastest growing neurodegenerative disease. It's nuts. ALS as well, and I have not seen any of those that don't have Lyme disease.
Really? Yeah, it's interesting. I remember years ago when I was doing research at the Mayo Clinic with a doctor who was a pioneer in MS research. And his whole theory is that there's viral origin of MS. And his colleagues, he was laughed at.
Are you kidding me? There's totally a virus, but I don't think that's the main cause. If you look at the lesions from Lyme, they're indistinguishable from MS. I've never seen an MS patient doesn't have Lyme, or at least Babesia, Bartonella. And then it's like a Lyme patient, every single one of them has reactivating because the immune system is still suppressed. And now you can't suppress all the Epstein-Barr, HHV6, tons of all these viruses, and most of we don't even test for. So yeah, they certainly contribute. Now they feed into the vicious cycle. But what's really the cause? But after time, it doesn't really matter but you gotta, and it's like, why is the Lyme even allowed to come out? Because the immune system. So if you fix the immune system, then it will just suppress everything. We have so many infections, but the body is healthy enough to suppress them. And that's what happened. Like people, like these infectious disease, they'll have all these antibiotics, like just slam them, nothing happens. That's what I did. I did 3.5 years of the highest dose IV antibiotics I would never give to a patient. It was 4, 5, 6, 7 times the max dose, and doing 3, 4, 5, 6, 7, 8 at a time, right? I'm like, Don, you don't care if I live or die anyways, I might as well kill it. Nothing. I would go in with sepsis, being on all that freaking antibiotics, because my natural killer cell function was 0. It was 0. So the body can never take over. So antibiotics do not kill anything totally. They knock it down enough and the body takes over. And I remember I was in Ford's Memorial and totally septic, just, dying like every 3 months like I did. And I remember the nurse, they're doing the shift change. I hear her say, this is that AIDS patient that keeps up turning negative for HIV. And she was kind of right, because I had no immune system.
Yeah.
And that's why we, kind of an immune modulatory clinic. And that's where we start. And things like POTS and and Sears, that you fix their immune system, and they go, what about the POTS? And all these neurologists are like, oh, you got fatigue because you got orthostatic hypotension. Please stop. It's like, it's a cause from everything. And you fix your immune system, POTS goes away there, all these symptoms. And it's pretty incredible so we kind of you fix the immune system first, that starts helping the mitochondria, and then you can kind of pick, because otherwise you're just treating this and this and this and this. But really the immune system I think really is at the hub of the spokes. and it basically will drive everything else. For instance, like mast cell activation, right? And Lyme, most people have a component of that. Well, all the POTS patients, and you fix the immune system because or also you'll find that if you look at a mast cell patient, they'll have low cortisol but high ACTH, and okay, well, what's going on there? And some of you give a little kindness of cortisol or immune modulators because their body is trying to raise that cortisol to basically tamping down the inflammation, but it's not working. So there's the central kind of same to the central hypothyroidism. And so corticotropin releasing hormone, it's just pumping that out, but the body's not responding. The ACH does, but the ACH it's the disconnect to the adrenals. But CRH is one of the most potent stimulators of mast cells. So if your ACH is high, your CRH is high, stimulating that. So you want to bring that down. And that's just like one little thing that all of a sudden you're like, oh my gosh, I feel so much better, And you got all these very good doctors, but they're just trying to get at the mast cells directly. You look upstream, and it's just so much more effective.
Yeah. So for Lyme disease, I know some doctors they have a particular regimen, apparently to deal with something as complex and persistent as Lyme, the organisms, that is important to, on one hand, to boost your own immune system's capability to fight it, but on the other hand, to actively kill them. To do these two things.
It goes hand in hand because direct killing helps, but you're never going to get there. If you don't have an immune system, you'll never be free of the stuff. So until you're able to fix that, but infections suppressing the immune system. So again, catch-22, right? So you may have to treat, but you really got to pay attention because the immune system is doing the killing. It's not the antibiotics. I mean, they'll knock it down.
Yeah, I'm wondering if you have a particular protocol because some doctors they do stem cells, and I know that you found
those are great for infections, and those are great for cancer. Infections. No, they're wonderful.
Yeah, so that's the aspect with boosting your immune system. But stem cells like MSCs also have antimicrobial properties. But in conjunction, you can use ozone therapy, or I know some doctors, integrated doctors, do silver IV infusions.
So love silver. I wrote a paper on oligodynamic silver hydrosol, and wrote a paper saying it cannot cause argyria. It was time where the blue guy was going around on the top show, was totally blue like a smirk, but he kept taking, and he was no colloidal silver. But what he was doing was making the silver by himself. He'd take the acidic bath with some silver electrodes, took a battery to it. He's just drinking the stuff. He's totally blue. Now, so I write this paper, and some other doctors got in trouble with the Holtorf Medical Board. They're horrible. I wrote a paper saying how safe it is. And then we were doing between 500 and 1,000 liters of this stuff, right? And it happened during Katrina, and I don't know how it happened, but I think we got someone better. They had this Katrina rash. No one knew what it was. Antibiotics didn't work, antiparasitics, and no one knew. These people were miserable. And someone came in and let's try this silver, and just it was wiping it out. And we had all these people. I mean, just we were flooded with people with Katrina rash. But it works amazing also for Morgellons. It's awesome. But, so I was always using our Argentine silver, and that's why I wrote the paper, You Cannot Get Argyria. Wayne Whiteman, he convinced me, he loved Gary Gordon, you're going to use this. And I did it. And within 2 weeks, I'm freaking blue. I'm tin blue. And I'm like, oh my God. I kind of didn't notice it. People noticed it. They didn't tell me. And then I also took Dapsone and got methylglobinaemia, and I was just like a smart that I take methylene blue to cure the I had at my house to cure that methylglobinaemia. But it's really irreversible, and it was bad. I mean, it was just shiny silver. I was like a tin man for a long time, and I still have it under my nails, but I think the rest is kind of done. But if I get a laser, let's say, like a cosmetic laser, people can't, it hurts so bad. It's like a tattoo. It explodes because the silver in my skin. So I still have certainly some. So I caution people with silver. I would only do the silver hydrosol, the arginine. The other ones I think are risky. I don't want to, there's probably, I'm sure, some good ones, but I don't think they understand what's going on.
Mm-hmm.
But stuff works great. Yeah, and with silver, it matters the surface area. So, and problem with like silver salts that you see in the coil silver, they're just like, it's like someone took silver and kind of like solid silver and threw it down. But you look at silver hydrosol, it's just totally dispersed. So lots of surface area that can attach to many things.
Mm-hmm. In your clinic, when you treat patients with Lyme, so do you use ozone?
Oh, yeah. And so that's a mainstay.
Okay. And do you also use silver?
Yeah.
Okay. And you just use stem cells.
Oh, of course. Yeah, stem cells, exosomes, yeah.
Yeah. And then peptides, which ones would you pick to help with
We use all of them. They all have their place and they all work. And it's interesting with the bioregulators, have they've come on and a little different. I'd say they're slower, but not always. It's interesting. Like with the kidney, it's like, damn, the kidney function gets better like very quickly, or liver. But in general, they're slow on, slow off. The peptides a little certainly quicker, but they work really well together. So you got the peptides as the cell surface, and then you got the ones working at the gene level. So if you think about illness, it's kind of like you have this assault at which the peptides get out, let's say like EMFs, right? And we had my other kid, I feel like I'm torturing all my kids, that we had him in a room with the router and everything, right? And all of a sudden he's getting these panic attacks. His heart is racing. I feel his heart rate is like totally irregular at like 180. I'm like, oh, damn, it's the EMF. Sorry, we put you in that closet there. But we gave him BPC, which blocks the calcium channels, the EMFs open the calcium channels, and also the cardiac bioregulator, and like started calming down at like 20, maybe 20 to 40 minutes. And after a couple hours, he's like, it was like he had a beta blocker or something. And he says, all this stuff is really neat. And if you were to take something for anti-aging, the epitalin with thymus, that combination, dramatic reduction in heart disease and cancer, increasing longevity, actually, they gave to cardiovascular patients, and they gave them 6 doses, followed them for 12 years. The ones that got the combination of the pinealin and thymus, their cardiovascular system got better. They actually had more endurance. The dramatic reduction in mortality, morbidity, increased quality of life. I mean, it's crazy. Like, why aren't everyone taking this? Because the benefits what's the downside cost, which is very, very minimal. And we just also discovered a skin bioregulator, which you take orally, and the skin, like, nice studies on it. And where we're adding to the studies that they get better. I'm very skeptical of all the cosmetic stuff. It's like, wow, well, and I'm like, damn, this is pretty cool. Take an oral thing. And there's so many claims made about supplements and things. So, but you can tell I'm excited about the stuff.
So you were talking about pinealon and thymus. So epitalon.
Yeah, but then not pinealon. Pinealon is awesome, but pinealon is not a pineal peptide.
Mm-hmm.
It's a subcortical peptide. So they really made it very difficult. But so epitalon is the pineal peptide. But like Biolon, which is only 2 amino acids, but 2 amino acids, how do you classify it? They classify it as a thymic peptide, but it has a lot of pineal effects.
Are you talking about TB500 and T-alpha-1? Are you talking about these 2?
Yeah. It'd be the thymogen, which is only 2 amino acids. So thymogen orally, it was shown to be 100 times more potent than thymulin injectable.
Okay. I see.
And also that's very senolytic. And you can't convert IgM to IgG if you have low Th1. It basically causes senescence. So you get, with it low Th1 is immunosenescence. So the body, with stress, reactive oxygen species, toxins, the cells will start going into senescence. So what happens is they kind of shut down the mitochondria, go into cell danger response. And instead of making energy, they start making reactive oxygen species. And people with diabetes and heart failure just have tons of this stuff. And so the cells that they have, they're instead of, like, say, a heart cell pumping and contracting, it's basically making reactive oxygen species, recruiting more senescent cells and making everything worse, a vicious cycle. Now we can selectively knock out those senescent cells, but the senolytics do not work unless you have the high TH1 to basically recycle those and destroy it and recycle it. So you really need to have the immune system, like, in so many things. That's what I'm saying. So it's so important. If you will get senolytics, I think it probably isn't going to work. Maybe a little bit, but because the mechanism it knocks out, it doesn't matter. You can knock it out, but there's nothing there to kill it, right? It's like, oh, we're going to make all these defensive, we're going to knock out the defenses, but there's no one attacking it, right? So, it's just the key to so many things.
Yeah, and to raise the TH1 system, that's using, is that, you said just using thymogen? That's the best way?
Yeah, so really, that's what the thymus does. It keeps bringing the TH1, lowering the TH2, and you can also add Tregs over here. So, and they used to think you'll see, like, they'll say, oh, Hashimoto's a TH1 dominant, and Graves is TH2 dominant. Well, wait, they respond to exactly the same thing. It makes no sense. And it's the problem is that there's some labs there that they're looking at, okay, like the cytokines that stimulate TH1 are high, right? So they'll say, oh, you're TH1 dominant. No, it's kind of like the TSH high in saying you're high thyroid. It's like it's trying to do it, but it can't. So there's a lot of misinformation out there about that, where and what they couldn't differentiate between TH17 and TH1. And TH17 is the autoimmune one, and so they call it TH1. But I go, oh, well, it's TH17, which is on TH2 side. So due to a lot of, I think people not thinking through, there's been a lot of stuff thrown out, and then labs have capitalized, and they throw people off and make them do the wrong thing.
Mm. If someone comes in with cancer, which is not uncommon, what peptides would you recommend them?
No, officially don't treat cancer per se.
It's a touchy subject for doctors.
It is, but even just the fact that I wasn't something I spent all my time on, right? And I don't want to miss something. But we don't refer out anything about cancer. Like, I think I referred one person just to get like some sort of heart scan or something like that. But it's crazy. But with the cancer, and there's some very good cancer doctors, but we had a problem. We were sending them out, and they're getting like high dose vitamin C or something. And I'm like, okay, I'd be scared of missing something. I wanted to get one thing from these, cancer doctors. So we're starting to do it because, the one thing, if you look at, for instance, this is like one of the most documented with, let's say, colon cancer, right? They get radiation you're cured, okay? Or, long remission. What does that mean? 5 years. If you follow those people, 6 years, 7 years, it's all over the place. Mm. And what's the biggest determinant of that, and they don't test it, they don't seem to care about it, is the level of the natural killer cell. Hmm. So natural killer cell function, not the number. So that's again, natural killer cell function. Natural killer cells, the ones that monitor the body for infections, for cancer. And so what they do with give chemo, it knocks out their immune system. Now there's nothing it's not searching, destroying the cancer. And it just explodes. And I know two people that I was pretty close to. And this is what I told them, but my doctor says, I'm like, and it totally happened almost to the day. I'm like, I prayed I was going to be wrong. But it's barbaric, and they just don't care. Well, actually, we see that. Like, why don't you think about why, all you have to do is give some $30 a month and could have prevented it. But again, it's all about the immune system. And that's why, people have all these reactivating, that's why we have, chronic Lyme, all these, chronic infections, because the immune system it's too low. and then you get reactivating infections. Now they pile on. So that's when it's very difficult to come back from that. Or like SIRS, chronic inflammatory response syndrome. And so you have generally a compromised immune system. Then you're exposed to mold toxins. The other people are generally fine, but now you can't tolerate it. The immune system is just trashed. Now, the standard protocol from Shoemaker, who I love, he's done so much for that immunity and set the protocols. But the whole thing was to take binders and get rid of the toxins so you could boost the immune system. Well, we have a way to boost the immune system now, and now you can detoxify better. And and I wrote an ebook on it, the peptide protocol for the rapid treatment of SIRS, and you get it, I think, on our site, or I don't know, because the people were on this stuff, and I'm like, how long have you been doing this? Like 8 years, but I know I'm going to get better. I'm like, oh my God, I'm too ADD. I can't wait 8 years. And they just get better in, several months. So, basically put that together, and they just heal this kind of backward, or it's just, instead of just looking at it a little different. I'm not saying anything is wrong with it. It's up BIP, basic intestinal peptide. It makes them worse. They feel better, but it actually makes them worse and they can't get better. I will butt heads with that. But people say, oh, like, you don't like Shoemaker. Absolutely not. It's amazing. We could not have come up with the stuff we did unless he was there first and just spent so much time and passion to figure this stuff out. That's probably way harder than Lyme, right? So, but it's these chronic multi-system illnesses that, we are so horrible at treating in America, really kind of all over the world. But now everything's multi-system. We got toxins in the food, pesticides. Pesticides are what basically the part of this is going crazy. And, we look at the treatments that have been done for some things that have been going around. Like, we'll check everyone's natural killer cell after, they jab. Natural killer cell function drops each one. And their immune activation and coagulation goes up. All their cells are clumping. Their immune system shot, and they often get reactivation of Lyme, viruses, and people. So many people, like most people, get Lyme, don't have a symptom, right? And we know this billionaire had a place in Africa where he went on safari and did that, and he went and he got mefloquine for mosquitoes and that stuff, and just it's a pretty toxic Lyme med, and he just all of a sudden just couldn't deal with this, wiped him out. Now it gave him Lyme, because he had all this stuff and it reactivated. And it's not my patient, actually, it's a doctor friend of mine up north, and he's like, oh my God, why did this happen? And that's what you see, or we'll find oftentimes people get Lyme after a emotional trauma. Like, emotion is so basically, it's so a profound suppression of the immune system, but doesn't suppress the immune system. It modulates it. So it lowers that Th1, raises that Th2. So you get that inflammation, but you can't fight your cellular infections. Where like stress from like work, but if you have like a kid that's ill or a fight with a spouse, or like I had my narcissistic brother, oh my God, the phone would ring and I would just be bedbound, you can't tolerate any stress, and it's just anything emotional is the worst.
Okay. So would you say that for Lyme patients, and there's much higher prevalence of cancer? Elevated cancer risk?
You know what? It's interesting that it's a very good question, because I've been looking for it. But the problem is you won't get the answer because the Infectious Society of America says chronic Lyme doesn't exist. So how can you do a study that shows that chronic Lyme is associated with cancer when it's something that doesn't exist?
Wow.
And that shows you right there. People are supposed to be treating it, and it's just like, okay, here's this study, la, 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 la.
Do you have an anti-aging stack when it comes to peptides? So if somebody's pretty healthy, I just want to live really long and stay in great shape.
I treat Lyme. I will never give it up, because that, you have to get back, and, for all my sins of my previous life, so I got to do it. But so we're about to launch a very, very comprehensive biologic age reduction program. We're guaranteeing 5 years reduction biologic age, with a number of tiers. But yeah, I think it's a great time to be alive. That there are things that you can do now to actually reduce your biologic age and actually live longer and live better longer. And I mean, there's just so many things. And yeah, I think peptides and bioregulators are at the center of it, but there's also so many other things as well. Which go into, suppressing mTOR with rapamycin, basically senolytics. I mean, there's, also, intermittent fasting, which I don't know if I'm a huge fan of, because if you look at the studies, a study by Libel and others now have shown that if you fast significantly or decrease your calorie intake 3 times, especially men can maybe go a little longer, but all of a sudden the body will suppress the thyroid, suppress the metabolism, and it won't go back to normal even when you go back to normal eating. So people say, I've wrecked my metabolism. They have. And well, that's what we test. And people who are sick, who are older, who can't lose weight, almost invariably, they will have approximately 25% lower metabolism of someone of the same age and weight. Everyone just, you're just eating bonbons in the closet, and they're tired and they're a little depressed, and then you give them T4, then doesn't work. And the studies where they proved that all these people were not low thyroid, they gave them all T4, didn't do anything. Like, we give the wrong stuff, but T3, but totally a dramatic improvement. So, and it's so simple too. It's so simple. And so many people need it. So we're probably missing 60 to 70% of people in the US are suboptimal thyroid.
Well, since Armour thyroid is a combination of T3 and T4 and is a more natural form.
It's better than Synthroid, but not much.
Really?
And all the studies show it.
Interesting. Because that's what's in the anti-aging functional medicine space.
I mean, if you have a patient who is totally healthy, no stress, not exposed to any toxins of it, not eating in the US, I guess. Yeah, they'll do okay on Synthroid and Armour. But the more things you add in there, stress, again, toxic food, any chronic illness, getting older, it just basically more and more you don't give T4 because it converts to reverse T3 and actually works against you, and it's a big problem.
I see. So are you taking T3?
Yeah, T3 saved my life. And that was the big thing it did. I was just like, oh my God, this is godsend.
So a question someone will ask is that, does that mean I'll be taking this T3 for the rest of my life?
Yeah, I mean, I don't need to. My levels are normal. And I feel pretty good. If I get stressed, I feel I need it. But it's not a huge difference. But also, the reason I continue to take it because it lowers all the cardiovascular risk factors. It's boosting mitochondria, and so it's actually anti-aging. But people on T4, they want to get off of it. It's just like they're doing it. It's kind of like the saving of the bioidentical hormone stuff, like giving Prempro and trying to convince people that that's the same as bioidentical. And it's just like, and they'll fight to the death. And it's just like, look at the studies. I published the bioidentical hormone debate, and so it's just like, what? How could you even argue that? You're evil. Like, I love, medical debates and clinical debates. I don't get, we'll just talk about it. But dude, that's like just ignoring on purpose just to fulfill whatever. Why do you want to give everyone freaking horse estrogen oral, which goes to the liver, increases, the clotting factors, has equivalent in it, which is very carcinogenic? Why don't you give something without it? And then progestin, which actually increases the risk for breast cancer, where you can get progesterone, which decreases the risk. Which one would you give? And they're just arguing over it, like, stop.
Mm-hmm. Yeah. I think the last peptide I want to ask you is a very popular semaglutide for weight loss. And there is, I've, heard of somebody getting severe pancreatitis, a very severe side effect. How concerned are you with somebody?
One thing, I don't think the pancreatitis is likely due to semaglutide. It's due to basically excessive weight loss, right? And they'll get the same rate. But there's a lot of GI side effects, and GERD is a big one. But actually, my girlfriend fixes. You give everyone BPC, dramatically cuts all that. Plus, it prevents pancreatitis. It basically lowers the inflammation. Then you can also take the pancreas bioregulator, the liver bioregulator, along with BPC and even TB4 frag, even and KPV, and you're going to prevent all that stuff because they're increasing protein synthesis. There's less stasis. The cells are more active. The mitochondria are more active, and lowering inflammation. They're also, like, for instance, like BPC is shown to almost every toxin, and like it will keep people from having symptoms. They won't overdose from like methamphetamine. They won't have they'll be like the toxic, basically lethal doses. But hey, this is not having the side effects. It prevents the toxicity from mycotoxin from pretty much across the board. It's pretty amazing. I talked about the EMFs, but it will. So when you give it with meds, especially even like the Lyme patients, they're taking tons of antibiotics. Their liver functions are going up, and even when you're killing the Lyme, it's like the liver functions go up. It may not even be the toxicity of the meds. It's because you're killing Lyme that's in the liver, but it will prevent all that, or at least I should say it will help prevent that, or So also, the studies with even like meds like ibuprofen or Tylenol is one of the most toxic substances. And you know what is a big cause of autism besides Tylenol? And we're giving it to the frickin' kids and pregnant mothers. It's ridiculous. It's horrible. It's barbaric. I'm sure Fauci's behind it some way. But no, it's just, I don't know. If he's so pissed. But the BBC will prevent so many toxicities and overdoses. And the thing is that like certain peptides get known for like TB4 frag, for basically reversing damage from a heart attack. Well, so they studied that part. Doesn't mean it won't do that for the brain or for the liver. And like, it works for a hangover if you take it, before, and because it prevents all that toxicity from the acetaldehyde that builds up. It's not from dehydration. It's from acetaldehyde. Because I had a beer because we have a hangover-free beer. We did double-blind longitudinal studies and put it out. But as soon as we did and published the studies, the Bureau back of Firearm said, nope, can't make a healthy beer. So we moved on. But fun industry, though. Yeah, it's kind of amazing stuff, but it's just, I don't know. The misinformation from people they freaking know, too,
Yeah. Wow. Okay. This is fantastic. Such a fascinating.
Right, sorry about bidding on the soapbox over and over.
There's just so much. You've been in the space for so long. You've seen so much, and you know so much. It's exciting, and I know your clinic's very busy. People with very serious conditions, come to you for help. So.
Can I mention one thing? Just because if there's someone out there that we know. So I took kind of 2 years off. All I treated was the veterans. And all we did was treat special forces veterans, totally disabled, traumatic brain injury, post-traumatic stress. Very complex, sick as sick. They are the most humble, grateful people. So we were covering everything so we could do all the testing. And I figured it was going to be all over the board, right? But like one main one I'll tell you about was this kid, special forces, was totally terrible traumatic brain, couldn't read. He had allodynia, he can't even touch his skin. He couldn't sleep, total anxiety, pain, fatigue, sweating, in and out of the VA, outside neurologists. They're doing blocks on him and nothing's working. They find him face down. And basically in his house, pulseless, liver failure, kidney failure, rhabdomyolysis. He's not going to make it. Put him in induced coma just to wait and call parents in. He's freaking special forces. He makes it, right? But they said, what's he going to be like? But now he's actually has some bunch, but he still couldn't read, and just worsening pain. Neurologists, they don't know what to do. And then his mom knew, like girlfriend and a wife, blah, blah, blah. But he came in and the first visit, we got rid of his allodynia. And we had foot drop. He couldn't he couldn't control his split. And at the end of the first visit, he's like moving his split. And then this other doctor with me, also I'm talking to the mom, and he just starts smacking his split, right? I'm like, well, we're all jumping. What are you doing? He's like, it doesn't hurt. I mean, you can feel it, but it doesn't hurt. And then, so, long story short, he basically after 3 or 4 visits, pretty much back to normal, and he went camping. When he goes camping, they go no sleeping bags, nothing, that's what they do. But this is what we found in them. They all had the worst immunity ever. The Th1 was just non-existent and just tons of inflammation, tons of toxins, burn pits or whatever. They all had chronic Lyme, and most of them had a co-infection. Like, what the heck? I don't think they got it in Afghanistan. That's where they all went. So what's going on? So they're telling me they all rotate through Fort Bragg. I think they named it something else, Freedom or something. But in North Carolina, endemic Lyme, and laid in the bushes for about 3 months training. And so if you combine a chronic infection, you look at the studies, some things on cobalt mines, people with like heavy metal toxicity, if they get malaria or not, that someone with a very high toxin load gets an infection, chronic infection, they're very, very, very likely to get autoantibodies, especially to the brain. Every single one of these guys had antibodies to their serotonin receptors, norepinephrine, dopamine, and no wonder 60 plus are blowing their brains out every day because they're giving them antipsychotics, antidepressants, and when are that working? Because all the receptors are blocked.
Yeah.
And so we, but after about 2 years, I couldn't, it was just, it got so expensive. I had to put it on pause. But then, so we subsequently, we had to start back up, but we got a grant. One of our new doctors got it through his medical school. And then another agency helped us looks like we'll probably get a nice, like 300,000. And then after that, we'll be like $1 million plus, so we can really start treating these vets. But it's just horrible the way these vets are treated. They're getting the worst care ever, and they deserve the most. And I remember I was at a party, and this guy's like crying in the corner, and I know what's going on. Oh, he's a veteran, and he messed up, and he's getting divorced, like they all are. And I went up to him, how you doing? He's, oh, you understand? I'm like, let me guess, you got He's like, how do you know that? The VA says, I'm so unique. I've never seen anything like it. I'm like, he's the quintessential, it's like nuts. So, and in finance, they just come in, it won't cost you anything. They don't come in. Like, it's very strange. Like, they're just too autonomous or something. But they are the nicest people, but they need help and they're not getting it. So we're going to try to change that.
Yes. Yeah. We love our veterans at our clinic too. So we definitely, we would do things very special for them. And you're right. Some of the nicest people, kind, open heart, just humble. Yeah. So, well, Dr. Holtorf, what a conversation.
Hey, thank you so much for having me. I miss you. I forgot to say this to you.
Your wealth of knowledge and passion as well, and also your humility, of always, is really nice.
I think people, especially Doc, can take themselves too seriously,
Yeah. So how do people find you and benefit from everything you've developed?
Let's see. Yeah. Integrated Peptides. We're coming out with some new stuff, which is exciting. I kind of get into that. National Academy of Hypothyroidism. We need to kind of beef that up, but a lot of review articles. And, if you're fatigued, your hip is way, whatever, you need to make sure you fix your thyroid, find a doctor that understands that stuff. Probably going to start a podcast. We're trying to follow in your footsteps. Launch, we're actually two separate ones. Went through doctor talks, which are from the peptide summits. I have like 60 interviews of doctors. So we're going to kind of replay that on one thing, but then we're going to do live stuff. So you have to agree to come on ours. You have to slum it and
absolutely. I would love to.
I'm going to call you. You're like, oh, my people will get back to you, and they'll never hear.
Ever. No, I'm not like that.
Yeah, so we're praying. We've got some great new doctors. I just love them. Passionate. We're actually doing for like complex patients, because it's like, how it gets old, even though God, my heart goes out to them, but it just wears on you. So we're doing like kind of like old school, like we have like our new doctors, like 4 or 5 or 6 of them, and we all sit around and they, we basically all listen to case, go back and forth, and everything's recorded. And because the patients, they go from doctor to doctor, they don't know who to believe. Now you've got, 5 very experienced, just passionate, most caring doctors. And you could hear what the rationale is in the thought. So we've just kind of started it, and the feedback has been great for people.
Wow. That's great. That's powerful. I love that.
Yeah, it's fun too. It kind of brings the fun back in it. So it's really a win-win, and patients love it. Yeah.
Yeah, wonderful. So your center is in California, in El Segundo, and how do people get in contact with you?
Yeah, it's holtorfmed.com. Again, we have some awesome doctors. I just love these people, and they're all bringing their own unique experiences and therapy. So we're just adding like therapies every couple of days. So it's really neat, and just they're neat people. Then lecture, all around, and so we're trying. One thing we do suck at is marketing. So we may not know where we are, but yeah, we're in El Segundo, Holtorf Medical Group, Integrated Peptides. I'm the medical director. I'm not. They're separate. Integrated Peptides separate, but I like what they do, and again, I started it, but then handed it off to be separate. So cool stuff coming out.
Okay. All right, Dr. Holtorf. So that's the Holtorf. And you're fabulous. And thank you for being my guest to share your knowledge.
Hey, thanks so much, Joy. You're awesome. Appreciate it.
Thank you.